A splendid good day to you all, and thank you so much for choosing Equinoxe Radio Multimedia to get yourself informed on health-related matters. Today we'll be looking at something very delicate known as cataract. Today, Cameroon joins the world to commemorate World Cataract Day under the theme, Children Love Your Eyes. Pediatric cataract is an alarming problem all over the world in need of intervention and management, especially in developing countries, including Cameroon. Pediatric cataract is responsible for 5% to 20% of blindness in children worldwide. In today's edition of the program, we'll look at efficient ways of managing this cataract amongst children. And just close to me is my co-host, our beautiful co-host for sure, Asa Lucy Yengo. Hello, Lucy.
Hello, Immaculate. Hello to all our listeners and viewers out there.
And my guest today is already right here in the studio. Our guest is an ophthalmologist at the President Eye Hospital, Acha Bipanda. She's known as Dr. AWUM Joyce Teko. It's a pleasure to have you on the program today.
Thank you. Same.
Now, we are going to be looking at something very delicate, as I earlier said, and it's known as cataract. But before coming to that, we would like to know what are some common eye problems affecting children and how do they differ from adults?
Thank you. Well, talking about common eye problems affecting children, we need to first start by mentioning the fact that children's eye problems can always be specific to them, though there are some conditions that may be common in children as well as in adults. And the way to look at it globally, we can classify them as those conditions that they can get right from birth, while others they may acquire in the course of their lifetime. So when we look at congenital conditions, those that they can get from birth, there's something also known as you said, pediatric cataract, which is quite common. There are also things like pediatric glaucoma. Children actually can be born with congenital glaucoma. There are also children who come out with other opacities like what is known as corneal opacities, which is a part of the eye, which is a clear part of the eye, in front of the eye. But you see children who have some malformations and they have to come out with such opacities. And also common in our community are children who also have what is known as refractive errors. And this has to do with deformities with regards to maybe the eyeball. You see children who may be short-sighted or long-sighted. And there are other conditions that they also can develop in the course of life due to maybe other issues like inflammations that may occur in the eyes. We have children who suffer from things like uveitis. And also children can equally suffer from cancers. There are cancers that are common in children, the most common known as retinoblastoma, which affects young children. And so these are some few conditions that we observe. And lastly, we have things like allergic conjunctivitis, which most children suffer from, especially when you notice them in their schools, itching their eyes. And these are some of the few conditions I think I can mention.
Now, our focus today is cataract. What are cataracts and how do they specifically affect children's vision?
So as a basic definition of cataract, we can simply say that cataract is the clouding or the opacification of a clear part of the eye, which is known as the lens. And this crystal lens actually is a part of the eye which is found, let's say, in the front part of the eye, and is actually not transparent. And once it gets opacified, it hinders the entry of natural light to get to a sensitive part of the eye, which is at the back of the eye, and this is known as the retina. And it's from this retina that the light is focused on, so that information can reach the brain, so that everyone can see. And so once this clear part of the eye, known as the lens, is opacified, most of the time it gets opacified by a disruption in its normal metabolism, because normally it is not, it doesn't have vessels, and so it usually stays dehydrated, no water. Once the water infiltrates this part of the eye, it gets blurred, it gets opacified, and so there's a hindrance for light to actually get to the back of the eye, which is very essential for focusing light for vision to come about.
What are some symptoms that parents should watch out for?
So some of the symptoms that parents would watch out for, and it's what we have as complaints, and the complaints actually are coming from the parents because the children themselves are not really able to express themselves to say what they are feeling or what they notice. So some of the symptoms that parents can watch out for, we can have these whitish spots that can appear on their child's eye. They may notice it at a certain point in time that the child was born with a whitish spot. Equally, they may notice that the child may not be focusing well. Let's say the child's eye is deviating, and so the parent may observe the child, seeing that the child doesn't probably look straight on certain things that he tries to look at. There are other things such as a shaky eye. You may see that the child's eye is not stable, and this is known as nystagmus. And so you may notice that your child's eye is like always dangling. Equally, there are children, depending on the type of cataract, there are children who may also have this problem of light. And so the parents may notice that the child is really disturbed by light. Equally, the habit of the child can be an issue. Like they can notice that the child usually bumps into objects, and the child is always training. The child is always training, like to get close to the TV or to use some iPad. The child wants to get closer and things like that. And also the teacher can also be the one to notice something in class, like the child is not able to really copy his notes because he's complaining that he can't see from a distance. And so these are some of the few things that the parents can notice.
We are talking about a delicate disease, which is a eye condition, a sight condition. Now, what are some factors that can lead to the cataracts?
Now, some factors that can lead to cataracts, and I think specifically for children, we would like to classify these like those are, as I said, congenital, and those that may just be acquired in the course of their lifetime. Now, with regards to congenital, it's interesting to know that cataracts in children can be hereditary. That means in some families, you realize that most of the people have suffered from cataracts, and this most of the time will present itself bilateral. That means both eyes, and that's very specific. Equally, in the course of women's antenatal consultations, they will notice that they are asked to do a couple of tests. And most of these tests has to do with infections that they can get in pregnancy, like what is known as toxoplasmosis, which is a parasite. They can get rubella, which is a virus. They can get cytomegalovirus. They can get herpes virus. And all these actually are infections that can actually lead to cataract in the children. And so it is so essential for mothers to take their antenatal clinics seriously in order to prevent their children from getting these cataracts early in their lifetime. Equally, we can have situations where children are born with different types of syndromes. For example, I'll mention one of the common ones, which is Down syndrome. Down syndrome actually is a condition which can actually lead to cataract in children. They can have that ability to get cataract in their lifetime. We can also have other things like children also may be suffering from diabetes. It's also they get prone to getting cataract in their lifetime, or other metabolic conditions like what is known like homocystinuria and many other things. And in acquiring cataract in their lifetime can also be incidences of trauma. There are children who suffer from some specific trauma which will affect the lens, and they end up developing cataract early enough. Also, we have children who suffer from things like uveitis, which is an inflammation that can occur in the eye, and these things also can cause cataract. And finally, we have drugs like steroids, because I see many families where children are just put eye drops just anyhow, like if they have an eye condition, they just buy from the pharmacy or just anyway. The use of such drugs like steroids can actually induce cataract with time. So these are some of the things.
Now, with the case of Karen, what are some treatment options available for children diagnosed with cataract?
Okay, so the treatment options are actually very clear. The cataract, basically, the treatment for cataract is surgery, and that's the same thing in children. However, with regards to maybe the type of cataract, the age of the child, and the laterality, whether it is both eyes, one eye, we can tarry and use maybe do some refraction to have the children use glasses for some time and see how it goes, and they finally usually end up with surgery, which is
we have a call on the line. We'll get this caller. Hello.
Hello.
Yes, madam. Good afternoon.
Hello.
Good afternoon, madam.
C'est pour l'émission.
Sorry. Yes, c'est pour l'émission, madame. Vous pouvez demander votre question? We are sorry that for that poor network. You can still try ahead to call and ask your questions, but whenever you want to call, make sure your receiver is turned off. So now, doctor, we would like to know, given that there are treatment options, which you just talked about, surgery, apart from surgery, what are some other ways to prevent cataract from getting worse?
Okay. Other ways from preventing cataract from getting worse, we have like in children particularly, since we are talking about children, it's good to encourage children to have very safe activities outside, preventing them from using like very dangerous objects during their plays outside, because it can lead to cataract. And also these children who start smoking early is a problem, because smoking itself has the potential of causing a kind of a damage to children's lens, and that comes early enough. And for children who already have conditions like Down syndrome, as I said, who have diabetes, it's good to put them on a good management, good follow-up, so that they don't develop cataract and it goes unnoticed. And also being careful about using steroids just anyhow, and managing eye conditions like uveitis, which is inflammation in the eye, very effectively. And such things can actually help to prevent the progression of cataract. Yeah.
And after a surgery, is it still advisable, or do children still need to put on their glasses?
Definitely. This is very, very interesting, because most of the time, cataract in children is very challenging. The surgery in children is very challenging. Why? Because, when we do cataract surgery, a lens is instilled in the child's eye, an implant, and the eye of a child is still in development. Actually, the visual development is ongoing, the length of the child's eye is still growing. And so most of the time, the eye changes with time, and the correction has to go on, and there's a follow-up that is done so that the child can get the best vision. And so it is usually very essential for the children to have lenses, especially the very young ones, because once cataract surgery is done, the lens that is put cannot really permit them to do near activities. And so these children who probably are still creeping, and most of the activities has to do with near vision, they need the glasses because they want to carry on to see what is around them. Far vision may not be an issue, but for near vision, they definitely need glasses to help them around.
And now, this year, the theme is Children, Love Your Sight or Love Your Eyes. What are some of the lifestyle changes that children or parents can consider in order to reduce the risks of developing cataracts in children?
Okay, so as I earlier said,
we'll have to cut you a little bit. We have a call on the line. Hello.
Yeah, good afternoon.
Good afternoon, sir. Your name, where you're calling from, and your question.
Yeah, I'm calling from Amanda. I just wish to ask, after operation, you are seeing cloudy. Your vision is cloudy. And you go in for laser. It's cloudy again. How do you really do to clear the clouds?
Okay. Thank you so much for participating. Thank you.
Because I was operated upon, and that's my problem now.
Okay. I guess you got the question?
Yeah.
Question.
Thank you so much, sir, for your question. I think that's a general question.
Yeah.
That after cataract surgery, you still have your vision is cloudy.
Yes.
And I think that question can actually specifically go to say that there are many things that can make someone's vision to be cloudy even after cataract surgery. That's why there's always this counseling that is done before surgery. And also after surgery. And usually a lot of things can come up before surgery that could also still lead to poor vision even after cataract surgery. And some of those things we try to diagnose early. For example, if a patient already is a diabetic patient, they will never know if the diabetes would have already affected the back part of his eye. And equally, in the after surgery, there are also some things that can cause the lens that have been placed to still be cloudy, which is usually called a posterior capsular opacity, and laser can be used to remove that. That's just a natural occurrence that can occur on any post-op cataract surgery, which can be managed.
It was a pleasure to have you, Dr. AWUM Joyce Teko, who is an ophthalmologist at the Presbyterian Eye Hospital, Acha Bipanda, right here in the city of Douala. Thank you so much for being here.
Thank you.
Equally big thanks to you, Lucy, for participating in the program.
Always a pleasure.
And that's what put an end to today's edition of the program You're in Your Health on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. I received technical assistance from Jonathan Babula and Bertram Bonzini. Stay in the company of more interesting programs, of course, on Equinoxe Radio and television. So long.